Thank you very much and for the kind invitation. I'm presenting on behalf of the ERS, which is not just a European society, but a global one. In our last meeting, we had over 23,000 people attending from over 130 countries. So our focus absolutely is in preventing chronic respiratory disease, and our focus also, of course, is on air pollution. We try to advocate raising respiratory health as a major public health issue, address environmental exposures as a whole, and an increasing and important focus on tackling air pollution. Now, we know, of course, we've had major successes as for anti-smoking. This is on that right as asbestos inhalation. We have the WHO guidelines about what we should do for particles less than 10 microns, PM10 and PM2.5, and nitrogen dioxide, of course. So in terms of public health, we think of this as a pyramid. We have at the top, if you like, education, a lot of individual effort, and an important one, first, especially for healthcare professionals, a way of communicating risks to the patients. And as we move down, where we have increasing population impact, of course, we have advocacy for clean air, clean breathable air and smoke-free zones, and perhaps even more importantly, the issues of health inequalities in London, where I work. The most impoverished populations are exposed to the highest levels of air pollution and are actually emitting less air pollution than less socially deprived areas. Absolutely, we accept, and we know, of course, we've heard that air pollution is a major invisible toxic killer, and 23% of the deaths we're thinking are related to environmental factors, and amongst those, respiratory is there. I know you saw that picture from Dr. Billow. We have chronic respiratory disease at 5, but if we've got respiratory infections at 7, and I think we should combine those in the sense that many of the chronic respiratory diseases we see, exacerbations, lung function decline, are triggered by this interaction between infections and subsequent lung damage. So it certainly we shouldn't really think of that as separate entities. And this is a busy slide, again emphasizing what you've seen in terms of the conditions that we know associated with deaths from non-communicable diseases, ischemic heart disease in the green bands, stroke, lung cancer, especially non-smoking lung cancer, and COPD. And if you just glance down household air pollution, what we're talking about, of course, is indoor air pollution in low and middle income countries, and then ambient air pollution predominantly from fossil fuel, and in some countries from industrial sources as well. Now, we have a lot of work going on in terms of air pollution, and this is one that I was involved with as a joint European Respiratory Society and American Thoracic Society. It should be free text. You can go onto the site and download it, thinking about the issues such as what exactly constitutes an adverse health effect. And you can think that this may be somewhat esoteric, but it is important when we're trying to work out what exactly we're going to focus on, and I would commend you to this document that was published only last year. Of course, we've heard of the legion effects of air pollution in the body, and the more we look, the more we see. I think that's the important thing, and it's really, really shocking that it's not just in the lung, it's by the distant effects of which the mechanisms are still unclear, but I'd emphasize, if you look down on the developing fetus, but also on emerging effects on cognition, very, very important and worrying, both in children and in elderly, and effects on the adipose tissue and associations with type 2 and possibly even type 1 diabetes. Of course, these are mediated by distant effects, so the air pollution are triggering effects which are then leaching out into the circulation. So it's not surprising, in the same way as smoking, that air pollution have these. And I just give you this, not that to highlight, but as a pediatrician, I don't need to apologize for talking about deaths from air pollution. Of course, fortunately, many children aren't dying from air pollution, but we have to take a life course approach in the sense that exposures from the fetus and during the whole of childhood are building up that vulnerability or the less resilience to air pollution. And if we just run down to looking at reduced lung growth, which I will be dealing with my talk tomorrow, this afternoon, very important in terms of your capacity to deal with disease if you develop it. We have provided some tools for our clinicians to just inform them about air pollution. This is an example from our European Society White Book. Again, this is downloadable as a PDF, and it just gives information from the left about what pollutants are, what the exposures are, the acute effects and the chronic effects. So this is sort of information in a way that people can, our healthcare professionals can take and try and translate. But I must say that we're being very ineffective at the moment in giving the tools for health professions to communicate the risks of air pollution to our patients and patients with non-communicable diseases such as COPD. We need to really step up our game and be able to do that in a way, for example, in an individual who's working, how would you deal with a day with high air pollution? So in terms of targeting air pollution, we've heard, I mean, this is not rocket science. We're pushing air pollution as a political priority. We do need to keep doing that. There's a tremendous, there's a pushback, certainly in the UK, when we're talking about in my interest of diesel, removing the current toxic diesel fleet. A lot of pushback in government from lobbying. We need to involve the health sector in the UK, for example. It's the biggest employer, so we need to get our transport right, and that should be one way of doing it. And enforcement of current legislation, very, very important in some countries, including, I'm afraid, the UK. Poor quality of renewal, the MOT or the TÜV in Germany, very poor in recognizing vehicles which are not performing adequately in real life, and of course combining air pollution and climate change, a win-win. And I think if we're having a take-home message, and it's been alluded to, we have to have the idea that air pollution is affecting everybody, and especially in terms of vulnerable population, unborn babies to the very elderly. And this is what I was alluding to in terms of climate change. Of course, we can get into a win-win situation by removing fossil fuel emissions. We will be getting into the point where we also will be contributing to attenuating climate change. And of course, by encouraging actions such as active transport, and increased exercise, this is the way to go. And I think in 20 years' time, we'll be looking back at the environments that we're living in and realizing how inadequate they were in terms of chronic lung disease. Thank you very much.